Hello, I'm Dr. Anthony Colantonio, Medical Director of the Clinic for Specialty Pain Services at Meadville Medical Center. You have been referred for an injection in your lower back, otherwise known as the lumbar spine. The injection is called a selective nerve root block. Since the medication that's injected goes to a space immediately surrounding a pinched nerve in your lumbar spine. If we look at the model here, we can appreciate the fact that in between each of the vertebrae in the lumbar spine, there is a small opening, and there is a nerve that exits from your spinal cord through that opening. The opening is called a neural foramen. If we look at the spine in cross-section, we could see here how the nerve comes off from the spinal cord and tries to make its way out of that foramen. It then goes across your back and down the leg. The injection contains steroid and is intended to reduce the inflammation around your spinal cord, inflammation that is contributing to your pain and symptoms. There is no permanent structural change to your anatomy as a result of these injections. Therefore, it is expected that results will be temporary. The results can last anywhere between several weeks up to several months. The longer the benefit from the first treatment, the better the prognosis that occasional injection therapy will be adequate for your treatment. Otherwise, you will need to discuss surgical options with your other doctors or consider chronic use of non-narcotic prescription medications. The injection is performed under X-ray to increase the accuracy and safety of the injection. You will lay in a face-down position for the injection, and it will take between 10 and 15 minutes to complete. You'll be laying in a position as represented by this spine model, head up here, tailbone down here. Under X-ray, we're actually able to visualize the opening, or what we call the neural foramen earlier, and we'll be able to then position our needle into that foramen to complete the selective nerve root block. If you have significant anxiety about procedures, you can ask about the option of conscious sedation. The risks of the injection include bleeding, infection, and increased pain during and after the injection. These are all very rare. Bleeding is unlikely to occur unless you are routinely taking blood thinners. If necessary, we will instruct you on how to adjust such medications before the injection to minimize bleeding risks. Infection is also extremely rare. It is very important to note that if you have or develop any infection or illness between this appointment and your scheduled injection, that you then inform our office of that situation right away. In that case, your injection will need to be rescheduled. It would not be safe to perform a spinal injection in the setting of an active infection. You may experience pain during or after the injection. This occasionally occurs because the nerve is already pinched and compromised. The liquid medication may temporarily irritate the nerve as it occupies an already limited space in the area around that nerve. Increases in pain, if they occur, are usually temporary and resolve within hours to a few days. There are some general risks regarding steroid that you should be aware of. One of these risks is that steroid can have a negative effect on bone density. If you have osteopenia or osteoporosis, steroid exposure could have further negative impact on these conditions, especially if steroid-containing injections are repeated over numerous times. A single injection is unlikely to result in any significant effect on osteopenia or osteoporosis. However, there would be concern in the setting of multiple repeated injections. It is therefore important that you let us know if you are currently receiving or expect to receive steroid-containing injections at other clinics from other physicians. Another issue associated with steroid exposure has to do with concern for the adrenal glands. These glands naturally make steroid in our body on a daily basis. Our natural steroid is called cortisol. If you are receiving steroid injections on a frequent basis, It is then possible that the adrenal glands will shut down, and this could cause a medical condition known as adrenal insufficiency. Finally, it is very common for blood sugar levels to increase after a steroid injection. This is of particular importance for our diabetic patients. The general medical recommendation is that daily blood sugar levels average 150 or below before proceeding with safe exposure to steroid injection. Baseline blood sugar levels will be elevated and may double or more for up to a week after the steroid injection. This may require diabetic patients to adjust insulin dosing if you are already prescribed insulin, and at a minimum, be very cautious with your dietary intake for the week after the steroid injection. If we decide to proceed with your injection, it is advised that you have a follow-up appointment with your referring physician around 4 weeks after the injection. This is an appropriate point in time to evaluate the response to initial treatment. Decisions about additional injections or other treatment options, including possible surgery, will be addressed during that appointment. Onset of relief from this injection averages 3 to 5 days from the procedure.